Top mental health recovery care practice for students. Question 1. Which chronic medical condition commonly triggers major depressive disorder? Option A, pain. Option B, hypertension. Option C, hypothyroidism. Option D, Crohn's disease. The correct answer is option A, pain. Chronic medical conditions can significantly impact mental health, often serving as triggers for major depressive disorder (MDD). The correct answer is a pain, as chronic pain is one of the most well-documented. Question 2. The healthcare provider is providing medication education to a patient who has been prescribed lithium to stabilize mood. Which early signs and symptoms of toxicity should the healthcare provider stress to the patient? Select one that does not apply. Option A, increased attentiveness. Option B, getting up at night to urinate. Option C, improved vision. Option D, an upset stomach for no apparent reason. The correct answer is option C, improved vision. Lithium is a mood stabilizer commonly used for bipolar disorder, but it has a narrow therapeutic index, making early recognition of toxicity crucial. The correct answer is C, improved vision, because this is never. Question 3. Which therapeutic intervention is most effective for social anxiety disorder? Option A, group therapy. Option B, behavioral rehearsal. Option C, cognitive behavioral therapy. Option D, medication management. The correct answer is option C, cognitive behavioral therapy. Cognitive behavioral therapy (CBT) is considered the most effective therapeutic intervention for social anxiety disorder. CBT helps individuals identify and change negative thought patterns and behaviors associated. Question 4. Which of the following is a common side effect of benzodiazepines prescribed for anxiety? Option A, insomnia. Option B, weight gain. Option C, drowsiness. Option D, increased appetite. The correct answer is option C, drowsiness. Drowsiness is a common side effect of benzodiazepines prescribed for anxiety. Benzodiazepines work by depressing the central nervous system, which can lead to drowsiness as a side effect. This sedative effect is. Question 5. For a patient with obsessive-compulsive disorder (OCD) who spends several hours a day washing her hands, which type of therapy is most appropriate? Option A, exposure and response prevention. Option B, dialectical behavior therapy. Option C, family therapy. Option D, interpersonal therapy. The correct answer is option A, exposure and response prevention. Exposure and response prevention (ERP) is the most appropriate therapy for managing OCD. ERP involves exposing the patient to anxiety-provoking stimuli such as touching dirty objects and preventing the compulsive. Question 6. When patients diagnosed with schizophrenia suffer from anosognosia, they often refuse medication, believing that option A, medications provided are ineffective. Option B, nurses are trying to control their minds. Option C, the medications will make them sick. Option D, they are not actually ill. The correct answer is option D, they are not actually ill. Anosognosia is a lack of insight that affects patients with schizophrenia, leading them to deny or lack awareness of their illness. This lack of awareness often results in patients refusing medication because they. Question 7. A patient with schizophrenia is prescribed risperidone. The nurse should monitor the patient for which common side effect of this medication? Option A, granulocytosis. Option B, weight gain. Option C, hair loss. Option D, hyperthyroidism. The correct answer is option B, weight gain. When a patient is prescribed risperidone, an atypical antipsychotic, the nurse should monitor for weight gain as it is a common side effect of this medication. Weight gain can occur due to metabolic changes and. Question 8. Which therapeutic communication statement might a psychiatric mental health registered nurse use when a patient's nursing diagnosis is altered thought processes? Option A. I know you say you hear voices, but I cannot hear them. Option B. Stop listening to the voices, they are not real. Option C. You say you hear voices, what are they telling you? Option D. Please tell the voices to leave you alone for now. The correct answer is option C. You say you hear voices, what are they telling you? The correct answer is C. You say you hear voices, what are they telling you? Because it employs therapeutic communication techniques that validate the patient's experience while encouraging further. Question 9. A patient with generalized anxiety disorder, GAD, is prescribed escitalopram. The nurse should educate the patient that the full therapeutic effect of this medication may take. Option A, 1 to 2 days. Option B, 1 to 2 weeks. Option C, 2 to 4 weeks. Option D, 6 to 8 weeks. The correct answer is option D, 6 to 8 weeks. Escitalopram, an SSRI used in treating generalized anxiety disorder, typically takes 6 to 8 weeks to achieve its full therapeutic effect. While some improvement may be noticed earlier, the maximum benefit is usually. Question 10. A woman was abducted and raped at gunpoint by an unknown assailant. When found, she was confused and disoriented. The nurse makes the following observations about the client. She is talking rapidly in disjointed phrases, is unable to concentrate, and is indecisive when asked to make simple decisions. The client's level of anxiety can be assessed as Option A, moderate, Option B, severe, Option C, mild, Option D, non-existent. The correct answer is Option B, severe. The client's presentation, including rapid and disjointed speech, inability to concentrate, and indecisiveness, are indicative of severe anxiety. These symptoms suggest a high level of distress and impairment in. Question 11. In pediatric mental health, there is a lack of sufficient numbers of community-based resources and providers, and there are long waiting lists for services. This has resulted in select one that doesn't apply. Option A, children of color and poor economic conditions being underserved. Option B, increased stress in the family unit. Option C, markedly increased funding. Option D, premature termination of services. The correct answer is Option C, markedly increased funding. The lack of resources in pediatric mental health leads to underserved populations, increased stress in the family unit, and premature termination of services. However, markedly increased funding does not align with. Question 12. Which statement demonstrates a well-structured attempt at limit setting? Option A, hitting me when you are angry is unacceptable. Option B, I expect you to behave yourself during dinner. Option C, come here, right now. Option D, good boys don't bite. The correct answer is Option A, hitting me when you are angry is unacceptable. Choice A, hitting me when you are angry is unacceptable, demonstrates a well-structured attempt at limit setting because it clearly defines the unacceptable behavior without ambiguity. This statement sets a clear. Question 13. In a patient with schizophrenia, which of the following symptoms would indicate a poor prognosis? Option A, auditory hallucinations. Option B, paranoia. Option C, flat affect. Option D, delusions of grandeur. The correct answer is Option C, flat affect. A flat affect, characterized by a lack of emotional expression, is often linked to a poorer prognosis in schizophrenia. It can hinder social interactions and affect the individual's ability to engage in therapy or. Question 14. April, a 10-year-old admitted to inpatient pediatric care, has been getting more and more wound up and is losing self-control in the day room. Timeout does not appear to be an effective tool for April to engage in self-reflection. April's mother admits to putting her in timeout up to 20 times a day. The nurse recognizes that. Option A, timeout is an important part of April's baseline discipline. Option B, timeout is no longer an effective therapeutic measure. Option C, April enjoys timeout and acts out to get some alone time. Option D, timeout will need to be replaced with seclusion and restraint. The correct answer is Option B, timeout is no longer an effective therapeutic measure. The correct choice is B because the scenario clearly demonstrates that timeout has lost its intended therapeutic effect for April. The key indicators are her increasing agitation and loss of self-control in the day. Question 15. To provide effective care for the patient diagnosed with schizophrenia, the nurse should frequently assess for which associated condition. Select one that doesn't apply. Option A, alcohol use disorder. Option B, major depressive disorder. Option C, stomach cancer. Option D, polydipsia. The correct answer is Option C, stomach cancer. Schizophrenia is often associated with comorbid conditions such as alcohol use disorder, major depressive disorder, polydipsia, and metabolic syndrome. Stomach cancer is not a common associated condition with. Question 16. A healthcare professional is teaching a patient about relaxation techniques to manage anxiety. Which technique is the healthcare professional most likely to recommend? Option A, deep breathing exercises. Option B, physical exercise. Option C, mindfulness meditation. Option D, journaling. The correct answer is Option A, deep breathing exercises. Deep breathing exercises are a widely recommended technique for managing anxiety and promoting relaxation. By focusing on deep, slow breaths, individuals can activate the botus relaxation response, leading to. Question 17. Adolescents often display fluctuations in mood along with undeveloped emotional regulation and poor tolerance for frustration. Emotional and behavioral control usually increases over the course of adolescence due to Option A, limited executive function. Option B, cerebellum maturation. Option C, cerebral stasis and hormonal changes. Option D, a slight reduction in brain volume. The correct answer is option B, cerebellum maturation. Adolescence is marked by significant neurodevelopmental changes that influence emotional regulation and behavioral control. The correct answer, B, cerebellum maturation, is supported by research showing that the Question 18. Tatiana has been hospitalized for an acute manic episode. On admission, the nurse suspects lithium toxicity. What assessment findings would indicate the nurse's suspicion as correct? Option A, shortness of breath, gastrointestinal distress, chronic cough. Option B, ataxia, severe hypotension, large volume of dilute urine. Option C, gastrointestinal distress, thirst, nystagmus. Option D, electroencephalographic changes, chest pain, dizziness. The correct answer is option B, ataxia, severe hypotension, large volume of dilute urine. The correct answer is B, ataxia, severe hypotension, and a large volume of dilute urine are classic signs of lithium toxicity. Ataxia refers to a lack of muscle coordination, severe hypotension indicates dangerously. Question 19. What information should the nurse provide in patient education for a patient prescribed sertraline for major depressive disorder? Option A, take the medication with food. Option B, it may take several weeks to feel the full effect. Option C, avoid consuming grapefruit while taking this medication. Option D, regular blood tests are necessary to monitor levels. The correct answer is option B, it may take several weeks to feel the full effect. Patients prescribed sertraline for major depressive disorder should be educated that it may take several weeks before experiencing the full therapeutic effects of the medication. This delay in onset of action is. Question 20. During cognitive behavioral therapy, a 12-year-old patient reports to the nurse practitioner. Option A, I was so mad I wanted to hit my mother. Option B, I thought that everyone at school hated me. That's not true. Most people like me and I have a friend named Todd. Option C, I forgot that you told me to breathe when I become angry. Option D, I scream as loud as I can when the train goes by the house. The correct answer is option B, I thought that everyone at school hated me. That's not true. Most people like me and I have a friend named Todd. In cognitive behavioral therapy, recognizing and challenging negative thoughts is crucial for progress. Choice B demonstrates the patient's ability to identify and correct distorted thoughts, indicating positive. Question 21. During an admission assessment and interview, which channels of information communication should the nurse be monitoring? Select one that doesn't apply. Option A, auditory. Option B, visual. Option C, written. Option D, tactile. The correct answer is option C, written. During an admission assessment and interview, the nurse must actively engage with and monitor multiple communication channels to gather comprehensive patient information. The correct answer is C, written, as it. Question 22. A nurse is reviewing prescriptions for a patient with major depression at the county clinic. Since the patient has a mild intellectual disability, the nurse would question which classification of antidepressant drugs. Option A, selective serotonin reuptake inhibitors. Option B, monoamine oxidase inhibitors. Option C, serotonin and norepinephrine reuptake inhibitors. Option D, all of the above. The correct answer is option B, monoamine oxidase inhibitors. Monoamine oxidase inhibitors are less suitable for patients with intellectual disabilities due to the need for dietary restrictions and close monitoring. These restrictions can be challenging for patients with mild. Question 23. In what order should the following goals be approached for a client being treated for alcoholism? Option A, learning about dependence and recovery, abstinence and development of a support system, attaining physiological stabilization, developing alternative coping skills. Option B, developing alternative coping skills, attaining physiological stabilization, learning about dependence and recovery, abstinence and development of a support system. Option C, abstinence and development of a support system, attaining physiological stabilization, learning about dependence and recovery, developing alternative coping skills. Option D, abstinence and development of a support system, learning about dependence and recovery, attaining physiological stabilization, developing alternative coping skills. The correct answer is option B, developing alternative coping skills, attaining physiological stabilization, learning about dependence and recovery, abstinence and development of a support system. When treating a client for alcoholism, it is important to follow a structured approach to maximize treatment effectiveness. The correct order of approaching goals is to first help the client in developing alternative Question 24. Which of the following would be the most appropriate intervention for a patient experiencing severe anxiety? Option A. Encourage the patient to talk about their feelings. Option B. Use a firm, authoritative approach. Option C. Stay with the patient and provide a quiet environment. Option D. Suggest the patient watch TV to distract themselves. The correct answer is option C. Stay with the patient and provide a quiet environment. During a severe anxiety episode, it's crucial to stay with the patient and create a quiet environment. This approach helps reduce anxiety by providing a sense of safety and support. Encouraging the patient to talk. Question 25. During pregnancy, a woman is in a relationship with a male who routinely abuses her. Her unborn child may engage in high-risk behavior as a teen as a result of Option A. Maternal stress. Option B. Parental nurturing. Option C. Appropriate stress responses in the brain. Option D. Memories of the abuse. The correct answer is option A. Maternal stress. Maternal stress during pregnancy can have long-term effects on the child's behavior and stress responses. Research shows that exposure to high levels of stress hormones in the womb can influence the developing fetal